We're now into the health segment of our show, and Lynn Omadou joins us with more health news.
Hello, how do you feel about snakes?
Oh,
okay, that's it. 5 million people worldwide, mostly in rural Asia and Africa, get bitten by venomous snakes each year. And as Kate Pound-Dawson reports, a shortage of antivenom is making the problem worse.
Larry Bulanati is known in the Philippines as the Cobra King because of his skill in hunting the feared spitting cobra, a highly venomous snake that spits toxin at its prey. Farmers in this area have asked him to rid their farms of cobras. Today, Bulanati was called by this farmer who found 2 snakes in his field. If he gets bitten by a cobra, he could die quickly. Hospitals are far away, and often they do not even have antivenom.
There is a good chance to find snakes here because the field has been cleared of places they could hide. Farm owners ask us to clear the field of snakes because it is a risk to their lives.
The World Health Organization says about 5 million people around the world are bitten by snakes each year. As many as 200,000 die, and about 400,000 lose limbs. Most victims are in developing countries in Africa and Asia. The WHO says victims in developing countries, many of them children, die because they are far from medical help and because there is a global scarcity of antivenom. Dr. Vasit Siprija runs the WHO Collaborating Center for Venomous Snake Toxicology and Research in Bangkok. He says the high cost of producing antivenom means poorer countries, such as Cambodia and Burma, cannot get adequate supplies.
It's our commitment or the term of reference for with WHO that we have to provide antivenom, and they order from us from time to time, but still not serve entirely the whole country, their country.
Unlike other medicines that can be mass-produced, Dr. Vasit says antivenom is often tailor-made for snakes from specific locations.
Although they may share the common toxin component, but I think the biological effect varies, depend on the environment, depend on genetic, and depend on the food they eat.
That means antivenom for a spitting cobra in the Philippines may not work on someone bitten by a similar snake in West Africa. In this snake farm in Bangkok, children are introduced to a variety of snakes. They learn that most snakes bite people only by accident, and they learn ways to avoid bites, such as wearing rubber boots. For now, experts say the best way to reduce the death and injury toll from snake bites are prevention and education. For producer Pras Laput, Kate Pound-Dawson, VOA News, Bangkok.
Well, part of the fun of traveling to another country is bringing back souvenirs from your trip. But in recent years, travelers have been bringing back something less welcome in their luggage: bed bugs. The insects are on the rise around the world. It is tempting to laugh off the problem of bed bugs, but these blood-sucking insects can be uncomfortable bedmates while you are sleeping. That's when they bite. These little 6-legged creatures cannot fly, but they do move. Because of worldwide increases in migration and international travel in recent decades, some studies have shown as much as a 500% increase in infestations in the U.S. and other countries. Jerome Goddard is an entomologist at Mississippi State University.
They're brought into a place in somebody's luggage or belongings. They start living there. It has nothing to do with how clean you are. In some of the cases I've investigated, they've been 5-star hotels.
Bed bugs all but disappeared in a number of countries with the use of pesticides like the deadly DDT. But after environmental and health concerns were raised, pest control methods were less effective and the bugs returned. Bed bugs hide during the day, so they are often hard to find. When they come out at night, they inject an anticoagulant to keep your blood flowing, as well as a numbing agent to prevent you from feeling the bite. Dr. Richard DeShasso of the University of Mississippi Medical Center says health experts are still not sure what effect bed bugs have on humans or how to treat them.
I think the most The closest thing to what we see is folks who react to mosquito bites get similar bumps. And so we use topical antihistamines, oral antihistamines, and if they're very severe, we will use topical high-potency steroids.
The study was published in the Journal of the American Medical Association. Well, between bed bugs and snakes, just be...
They're all bad.
Yeah.
Wow,
like
that's
Just be
creepy.
safe. Just stay safe when you're traveling.
That's
Well,
right.
as always, we get to hear very unexpectedly interesting news from Lino Madu, who joins us every Tuesday and Thursday right here on In Focus.
And for more news on these stories, go to voanews.com/TV to Africa.